Thank you so much, ladies and gentlemen, for watching Imani Television and keeping in touch with us always. Welcome to Health, Hygiene and Wellness. My name is Barasa Saenyi, and today in our program we are discussing about sickle cell anemia. I'm hosting Dr. Silas Uwambulwa, where we'll be giving you insights and educative points about sickle cell anemia. So stay tuned for this discussion, and by the end of it all, I know that you will be educated and you'll be aware of what you need to do about sickle cell anemia. Karibu sana daktari.
Thank you so much.
How are you?
I'm fine. Yeah, I thank God I'm well.
Yes.
Yeah.
Welcome to our program today.
Thank you.
I hope by the end of it all utakuwa umetupatia yote yenye unayo kuhusu sickle cell anemia.
Yes, kabisa.
To begin with, nimeona kwamba sickle cell anemia it's a disease that affects the circulatory system.
Yes. Kiswahili inaitwa selimundu.
Selimundu.
Yes.
I didn't know that. Wewe namna gani bwana?
Unajua sisi ni wasomi wa wala bin wala.
Yes.
So lazima tuongee Kiswahili sanifu, inaitwa selimundu. So it's actually a disease of in medicine we call it hematopoietic system. Hiyo ni system ambayo ya blood, circulatory system actually.
Yes.
It's not a cardiovascular disease, but it can cause cardiovascular complications. But it actually affects blood. It's a disease of the blood, specifically red blood cells. You know, there are 3 types of blood cells. We have the red blood cells, the white blood cells, and the platelets. So this sickle cell disease affects the red blood cell. And if you can reverse back in your biology,
yes,
the red blood cells have something called hemoglobin.
Yes.
So hemoglobin, its work is to carry oxygen. Whenever you hear that somebody has no oxygen, it means the red blood cells are carrying no oxygen. The function of the red blood cells is actually to carry oxygen from one point, specifically the heart,
yes,
to the cells. So if somebody has sickle cell, you realize that if these red blood cells are not very adequate, they might not have enough oxygen. Again, they might have anemia because the red blood cells, just by the name red,
yes,
and blood is red.
Yes.
It means if they are not sufficient, you won't have enough blood. So the red blood cells are very key when it matters with the amount of blood that a human being has. So if they are low in number, somebody will develop what we call anemia, which is actually upungufu wa damu kwa mwili. Yeah.
Now, how does it affect the red blood cells?
Now, sickle cell, just like the word itself, sickle, you know, the red blood cells normally are round in shape. But if somebody has sickle cell anemia, you've seen the shape of a sickle.
Yes.
Hii kitu ambayo natumia kufieka nyasi.
We will say ringa. We ringa. In the common language they call it ringa.
Ringa, yeah.
It's
curved.
Yes.
Somehow curved. So if somebody has sickle cell, the red blood cells look like a sickle. They are sickle shaped. So they are curved instead of being round. So the challenge with that is that, you know, there is a way God created our blood vessels.
Yes.
It was created in a way that it can allow blood cells to pass through without struggle. But if these cells are sickle shaped,
yes,
then it means they won't pass through the blood cells very well. Number 2, if the red blood cell is sickle shaped, then it cannot carry enough oxygen like a normal red blood cell.
Around the red blood cells.
Yes. So that is the challenge we have. So the challenge we have with sickle cell is that these sickle shaped cells can easily clog. They can block the arteries, causing pain, causing lack of enough supply of blood and even oxygen. So at times they stick to the walls. They are so sticky. Then another risk for those shaped cells, they don't stay the normal 120 days of a red blood cell. So the body perceives as if they are abnormal cells, so they are destroyed even within 30 days.
Earlier.
Yes, earlier. So that gives you the risk for anemia.
What is the cause of it being sickle shaped?
Now it is actually, you know, when a child is given birth to,
yes,
by both parents, they are supposed to inherit almost everything from the parents. You realize?
Yes.
So if your parent had round cells red blood cells. You're supposed to inherit that. But because of genetic modification, it's actually a disease that comes because of genetic predisposition. So these parents had a risk for sickles. Maybe they were carriers,
Yes.
or they were having sickle cell. So when they give birth to this child again, they are having those a child who has sickle cell. The strong cells of sickle cell. Actually, they have sickle cell. It means they have inherited the genes from the parents, probably both parents, and maybe one parent was a carrier, another parent who had sickle cell. So they'll give birth to a child who is having sickle cell. So this child, these cells will not grow up like the normal cells for other children who are not exposed to sickle cell. So that's why they are not shaped well like the other red blood cells. So it's just a matter of during the formation of this child in the womb, there was a challenge in the transition of the genes that make the red blood cells.
So we can classify sickle cell disease as a genetic disease.
Yes, it's a genetic disease. So it actually depends on your parents. So if you have sickle cell, it means 2 of your parents gave you the risk for sickle cell.
Coming to think about it, I was reading about sickle cell and found out that by the time that a child is born, immediately a child is born, when they do blood smearing, they can't find that the cells are sickle shaped. It is just normal. But after some times of growing is when they realize that the cells are now growing sickle shaped.
Yeah, you realize that if you ask parents who have children who have sickle cell, they'll tell you that they gave birth to you call them bouncing babies.
Yes, bouncing baby boy or girl.
Yeah, bouncing baby boy or a girl who was healthy enough. But after 2 years, 3 years, you realize that your child is now getting weak. They are not gaining weight. Those are the symptoms you'll have. The eyes are turning yellow. You realize that they are becoming anemic. They can't play like others. The milestones are delaying. So it does not come at birth, but it depends. It starts from maybe 2 years up to around 15 years. There's even a child who can develop sickle cell at 20 years. So it's not an exemption. It depends on how strong. Not all your red blood cells are sickle shaped. Remember that. Not all. If all were sickle shaped, then you could lose your life early.
Easily, yes.
But not all. We have some that attain the 120 days. They are normal shaped, but quite a number are sickle shaped. So these changes in cells depends on again your body.
Yes.
The manufacture, it depends on your bone marrow, how it's manufacturing the red blood cells. Yeah.
Now, how does one who has I heard that they are called sickle cell anemics, those who are suffering from sickle cell. Now, how do they feel?
Nowadays, we call them warriors.
Warriors. They are no longer anemics.
We used to call them sicklers. But sicklers means somebody who is
always sickly.
You see, so people don't remember that we are referring to somebody who has sickle cell. But they think we are calling them sicklers. So people are getting sick every day.
All the time.
Yeah, yes, it's true. They get sick all the time, but you don't need to call them sicklers.
Doctor, how do they feel when you have sickle cell anemia? Because this is something that is in your bloodstream, in your blood flow. How do you feel now that your cells are not rounded shaped? You don't have enough oxygen in your hemoglobin. How do you feel as a person when you have sickle cell?
The first symptom is actually getting tired. You feel tired because your body can't run without oxygen. No cell functions without oxygen. Oxygen is the driver. It's the injector of energy in your body. So if you don't have oxygen, you will not have energy, because you realize that for you to have energy, it has to bind to oxygen to generate energy.
Yes.
Without oxygen, no energy in your body. So that's one sign. The another sign is this child, because they are having that sickle cell, it will affect so many organs. Maybe wherever the blood clots, because this blood usually, the sickle cell shaped red blood cells,
yes,
your blood has to move around your body as the heart pumps. But when you have sickle cell, some of the cells, the red blood cells, are sticking to some parts of your body.
Yes.
So if you are unlucky that they stick to your kidneys, they can cause a kidney disease. If they stick to your eyes, they can cause blindness. If they stick to your heart, they can cause a clot, and you can even have a heart attack. They can stick to your brain cells, and maybe your arteries in the brain, you can get a stroke. So you'll find that these children will be very weak. Number two, because of insufficient supply of oxygen,
Yes.
also the bones won't grow well. So these children might grow up, but they are very feeble. They can't run. They can get fractures easily. They will be slim, you know. They'll have lost weight. Then also the changes in the cells, you know, when a child is growing up, we usually have fusion. Maybe the merging of the cells, like for example the head.
Yes.
We desire that a human being, by the time they reach 10 years, they should have achieved the adult size of the head. But again, these children might delay, so you will realize that the shape of the head might not be normal the way it was desired to be. So they might have some deformities. That's what I mean. They may be even lame. They may have an abnormal shape of the head. So that's what we look. Even the palate inside the mouth, realize that the bones, the jaw bones, are a bit raised. Yeah, so those are the common features of that child. Then the most common is anemia. And unfortunately, people usually treat sickle cell as malaria. A child goes to a dispensary, to a chemist, they are given drugs for malaria, they are given drugs for anemia, yet they have never tested for sickle cell. By the time you realize they have sickle cell, already this child is having complications. So if you are treating your child for malaria and they are not recovering well, definitely then you need to bring them for further checkup, because malaria is a disease that has to clear within 4 days. You can't treat malaria for 1 month. There are those children who have been treating malaria for 1 month. There are children I've seen who have been treated even for typhoid, brucella, and yet it's not brucella, it's not typhoid, it's sickle cell. Why don't you take them to a specialist who can understand if it's sickle cell, they treat.
But of course, Doctor, they need advice from you, medical practitioners, so as to go to another specialist.
Yeah, true. So I think there's a lot of confusion in diagnosing sickle cell, because it presents like malaria. You know, somebody is getting tired, they're having fevers, they are sweating, you know, they are getting lethargic. So it means likely they have malaria. Somebody will run for malaria. Even if you came to me, I'll first diagnose malaria. If it does not work, then I'll think outside the box and think it could be sickle cell.
Actually, that one ushers me to the next question. How do you diagnose sickle cell anemia?
Yeah, diagnosis of sickle cell anemia is a bit advanced, but they are simple tests. There's this old test we used to call sickling test. So you just go to the lab, they look at your cells, your red blood cells, then they test if there is a reaction for sickling test. There are actually some things that they do in the lab to find if it's positive. The other simple tests, a doctor can just take your blood, put it on a microscope, a doctor who understands, and they can see the shape of the red blood cells, if it's normal or not normal. Usually we call it a peripheral blood film. And they have to use a high power film microscope to look at that. Then we have also another test, we call it's a bit expensive, HB electrophoresis. So HB electrophoresis currently it's being done in bigger hospitals like the county hospitals, and some county hospitals. Like in this region of ours, we have Bungoma. Bungoma is able to do it. Transair are not able to do that. But if you have a child, you can do it even in Eldoret, MTRH. So it's a bit costly, almost 1,000 or 2,000 shillings. But if you have a child, you feel they have sickle cell, that test is the ultimate test, and we can easily know if your child has sickle cell. But the first things first, go to your hospital, ask your child to be screened for sickle cell. You have been treating for malaria, the child is getting weak every day, they are growing weak, they are not growing up, they are stunted. The other children, they have started to grow. Look out for sickle cell.
All right. Now, Dr. let's have some of the signs and symptoms that characterize sickle cell anemia.
The signs and symptoms, maybe we'll start, is it symptoms or signs? Symptoms. A child will be pale. They have yellow eyes. So if your child has yellow eyes, that could be sickle cell. Then deformities. these children have wounds that don't heal, just like diabetes. Wakijigonga mahali, the wounds don't heal easily. Then they can have even this, what we call boils, that keep on recurring, you know. Today you press this boil here, it moves here. You press it again here, it moves here. So those boils are not healing. They can have diseases that don't heal. If others are getting a cough or a cold, it is healing within 3 days. Theirs stays for almost a month. So, and they are getting weak. They are just deteriorating. They might lose appetite, or maybe they are feeding well, but they are not gaining weight.
Yes.
They are not, when they drop in school, if they are performing well, they start going down a bit in their performance. Then also they get weak. They get anemia. Anemia, actually, will realize a child gets tired easily. If you tell them to run, if you are to prefer sending them to the shop, you want them to be the last option, because kama unataka unga na unga imeshawekwa kwa meko,
hao si watu wa mbio,
hawezi kimbia. So if you realize your child has changed and they are getting that weak, and you have never tested for sickle cell, please go for it. Then there's another alarming thing. If one child has sickle cell in your family, extended family,
yes,
maybe your cousins, your brothers, and you have a child who is having those symptoms, please let them test, because these are diseases that runs in families. So if there is another cousin who had sickle cell and your child is having that, then the first thing you need to go is to rule out sickle cell. Both generations, from the 4th generation, 3rd, 2nd, and 1st generation. So all those generations, as long as there is somebody in your family who has sickle cell, you have to look for sickle cell also in your child who is getting sick. Then if one parent has sickle cell, definitely if a child develops such symptoms, you need to look for sickle cell.
Yes.
Then we have also parents who are carriers. So the mother is a carrier, the father is a carrier. The child might be having sickle cell. Unfortunately, if parents are carriers, they don't have symptoms, but they're just carriers of sickle cell.
Yes.
We'll look at that when we are preventing sickle cell.
Okay.
Yeah.
Now, Daktari, at that point, let's take a short break here on health, hygiene and wellness. Stay tuned to Imani Television. We'll be back with many more points about sickle cell anemia.